As the president-elect of our association, we have about 144 hospice companies in Louisiana that are really concerned about the governor's decision to withdraw hospice payments for hospice patients. That's about 1,700 people that effective February the 3rd would no longer be eligible for hospice care. Now, these are all families who are at the lower end of the economic scale. They're Medicaid only eligible, so they're not Medicare eligible, so they're not 65. And these are people who are what we refer to maybe as the working poor. And now that they have a life-ending disease, the governor is saying we're not going to provide care for them. We're either going to send them to a nursing home, which costs more, or we send them to a hospital that costs exceedingly more than what we can do in the homes. So we have 144 agencies, for-profit and non-profit, that are opposed to the governor's decision to save about $3 to $10 million when there are 1,700 people and family members who are going to have to sit at home watching their loved ones at end of life in agony, and then they may pick them up and bring them to the hospital, which costs considerably more. So we're opposed to the governor's decision, and we're asking him to rescind that order.
My comments are that hospice is really an interdisciplinary team to take care of the physical, emotional, and spiritual aspects of a patient's end-of-life care. And so by cutting the hospice Medicaid benefit, we really lose the team aspect of taking care of the patient, and I think that that's really what's so important about that, and it saddens me that the benefit is being cut and we lose that interdisciplinary team.
Previous administration decisions regarding the Medicaid budget will still remain intact. The savings will be realized from the original reduction, with hospice services continuing through this existing funding stream. Secretary Greenstein said, "We worked with the legislators and stakeholders to come up with a plan that continues to provide community-based hospice care for those in need, reform the ways these services are delivered, and continue to save taxpayer dollars. The reform program will be designed to better control expenditures, ensure efficiency and effective care for those who truly need it. Working with the Division of Administration, DHH has identified temporary bridge funding through available grant funds that have not yet been allocated. DHH will use these funds temporarily to continue hospice services as they exist today until the reform program is implemented this spring. The original reduction will still occur, and the savings within the budget will still be realized. In the existing program, Medicaid pays for hospice in both nursing homes and in community settings. Under the innovative model DHH is developing, Medicaid funding for hospice services will be focused on community-based recipients who meet certain criteria, as nursing homes are already responsible for providing comprehensive round-the-clock care. In addition to an emphasis on community-based services, the reformed Medicaid hospice program will be designed to better control expenditures and ensure the most efficient and effective use of taxpayer dollars. Better leverage relationships with nonprofit and faith-based organizations in the community to provide social, emotional, and spiritual support. Prevent conflicts of interest that can arise from when physicians who are affiliated with hospice providers certify need by those entering the program. Further strengthen the prior authorization process for hospice services to ensure resources are provided to those who truly need them, and restructure the hospice reimbursement rate paid to providers. DHH initially promulgated an emergency rule in December that would end hospice benefits for Medicaid recipients over the age of 21 who had not received a hospice eligibility determination by February 1st. Hospice is one of the few optional benefits provided through the Louisiana Medicaid program and has only been included in the Medicaid service since 2002. I want to thank the members of the legislature, the members and the leadership of the legislature who, throughout this process, have provided valuable guidance to the department, which has helped us create this improved model for delivering hospice care, Greenstein added. This is a great example of problem solving that benefits our Medicaid recipients and taxpayers, said Representative Speaker Chuck Cleakley. The House is always seeking opportunities to ensure that we're getting the best value for our Medicaid dollars, and I'm pleased that through this ongoing dialogue with the department about how to provide hospice services through Medicaid, we will be able to identify a solution that will yield a better program. I am glad the department was able to identify a way to achieve needed reforms in the hospice program and preserve the benefit for those who need it, said Senator Fred Mills, Vice Chairman and of the Senate Health and Welfare Committee. Senator Claytor and I have both expressed our desire to allow Medicaid-funded hospice to continue for recipients in the community, and the department was very responsive. We are pleased that they are pursuing this change. The Louisiana Department of Health and Hospitals strives to protect and promote health statewide and ensure access to medical, preventative, and rehabilitative services to all state citizens. To learn more about DHH, visit. So, your voices have been heard, and we will continue to work with the Department of Health and Hospitals to ensure that quality hospice care is available and affordable to every citizen in Louisiana, regardless of where they live. Thank you for your support. Thank you for being here.
I'm Cheryl Phelps, President-elect of our association, and I too want to thank each and every one of you for the phone calls, the emails, but most of all for your commitment to the people that we all serve. We serve one patient at a time, and I know you do as well. And it's always about doing the best you can for that patient that you serve. And thank you for that commitment. We're looking forward to a year of helping DHH fashion a hospice program that is truly for the people. Who can better help DHH than all of us? We know what we're doing. We really do. So in getting prepared for helping them, I will ask all of you to, if you have ideas and such, as to how we can make suggestions to the state, please let Jamie know, and you've got his address and email, because it's going to be a wonderful time for all of us in Louisiana, serving the people that need the help that we can provide. So thank you all for being here and making a very different presentation.
The number one thing is I just found out the great news as I was walking up here that that the cuts to hospice care were already restored. So yeah, woo! So I guess the first thing I could say is thank you to the governor. I really do believe that, you know, I'm very proud of my state and where I'm from, and I really do believe that here we have a culture that really supports life, and we have a culture that makes sure that the dignity of the human being is always there. And I think that one of the worst things that the state could have done is to tell those who are terminally ill, just fend for yourself. I think that not only does it not make sense for who we are as a people, but I think it also wouldn't have made sense financially, because people would have just showed up to more expensive hospital. So I'm really pleased to find out about this. Hospice is actually very important to me personally. My mother died whenever I was 4 years old of breast cancer. I don't think that it stops here, actually. I think that we have a lot to do in Louisiana for health care. We need to make sure that our people are healthy. We need to make sure that people have dignity. And I think that I have hope for our future in Louisiana, and I hope that we can count on all of y'all to help us with everything from the beginning of life to the end of life. Thank y'all so much.
In 2012, we have about 1,786 patients that are what we call Medicaid only. Medicaid is their funding source for their end-of-life care, and they spend an average of about 59 days on hospice before they die. Without hospice, then they would have no option but to go into the emergency room and into a hospital to be cared for at every crisis after crisis after crisis, and those multiple hospitalizations are what drive up the cost of health care. Hospice, this past year is about a $10 million line item, of which the state was responsible for about $3 million. The federal matches the other $6.5 million or so. That made up the rest of that, and we cared for about 1,700 patients, 1,800 patients in their homes with that. That works out to about $5,800 per patient. Now, think of what a hospitalization is going to cost at the end of life for that patient, and we're talking about, we're seeing those patients over a 2, 3, 4 month period of time. The average length of stay was 59 days. Some patients, though, are coming in for a day or two, and some are much longer. So we're calling attention to the fact that we think that this is not a good decision. This is not a good use of taxpayers' money to do away with the hospice Medicaid benefit. Other states have thought about getting rid of it, and they've actually proposed it, only to see their health care costs rise. Arizona being the most recent example, they saw their end-of-life costs rise 5% after they eliminated their hospice Medicaid benefit in 2009, and the governor quickly reinstated the benefit when they realized that those costs were rising. Other states, Ohio, Florida, Washington State, they've all toyed with the idea of getting rid of it, but when they ran the numbers, when they did the analysis, they realized that the state would be coming out on the short end. We don't want Louisiana to come out on the short end. We want to make sure that people have quality end-of-life care. Hospice is the gold standard. We've been doing this for 40 years. We provide folks with services in their home. We try and keep them out of institutions, out of hospitals. We provide them with the medical, nursing support, the psychosocial and spiritual and community support. We provide families with follow-up care after the patient's death. We provide them with all of the medications. We have the medications for pain and symptom management, as well as the durable medical equipment that keeps them comfortable at home through that end-of-life journey. We do this, we know how to do this. We care more because we are trained to especially take care of terminally ill patients. We cost less. This is not a good decision when you're going to say, well, we'll do away with hospice and let people go into nursing homes or go into a hospital at the end of life. We can do it better, and we do it better. And we have a 30-year track record here in Louisiana of doing just that.